Alright, so take a look again to the general endocrine map and let's go for the thyroid and parathyroid hormones. This last will be in a different video. So remember the targets. As you see in this short mind map, inputs to the hypothalamus are responsible for the release of a thyrotropin releasing hormone or TRH. That in turn stimulates the anterior pituitary to release thyroid stimulating hormone or TSH. This is the hormone that acts on the thyroid gland, so it releases T3 and T4. T4 needs to be converted to T3, which is the active type, before having any effect. About 80% of T3 comes from T4 by losing iodine. And as you see, this simple axis is under the control of negative feedback in the way that high levels of thyroid hormones or iodine cause the inhibition of TRH and TSH. The actions of the thyroid hormone are wide, but two major actions are to increase metabolic rate and protein synthesis, while in children it also fosters growth, including mental development and sexual maturity. More than 99.95% of T4 and 99.5% of T3 is in serum and are bound to the serum proteins. About 0.5% of T3 is in the serum as free. And is that free T3 and T4 concentrations in the blood that are responsible for the biologic activity. The binding proteins maintain serum free T3 and T4 within very tight limits and ensure that these hormones are accessible as needed to the tissues. Regarding the metabolic rate of tissues, this can increase by 60 to 100% when T4 increases. So the rate of glucose, fat and protein used to increase a lot. Only the retina, spleen and testes and also the lungs do not respond to T4 being increased. In a similar way, blood volume, cardiac output, heart rate, cardiac contractility, and ventilation are all increased when large amounts of T4 are present and converted to T3. The increase of gastrointestinal smooth muscle activity will raise motility, shortening the transit time and causing diarrhea. But also skeletal muscle can be affected, reacting faster and with increased strength in the presence of thyroid hormones. So, in relation with the dysfunction of the thyroid hormones, you can suffer hypothyroidism or hyperthyroidism. Hypothyroidism may be congenital or acquired due to primary pathology of the thyroid gland, or it can be secondary to hypothalamic and pituitary problems. For hyperthyroidism, the most common cause is Graves' disease, which is an autoimmune condition. Other causes of an excessive production would be multinodular goiter and adenoma of the thyroid gland. There is a particular condition named thyroid storm that represents an acute hyperthyroid state that we will review in a moment. So, congenital hypothyroidism affects 1 in 4,000 babies and causes mental retardation that can be prevented if detected just after birth. At the present, all babies are screened to assess whether they have a lack of thyroid gland production, non-functional thyroid hormones, or a deficiency of TSH. T4 is essential for normal brain development, and the deficiency may not be evident at the moment of birth because the baby still has maternal T4. If hormone replacement is not set to normalize T4 levels during the first 6 weeks of life, the infant will suffer cretinism, and this condition is most often due to maternal iodine deficiency during pregnancy than to any other cause. About acquired hypothyroidism, it may be primary, that is, affecting the thyroid gland itself, or secondary due to hypothalamic or pituitary malfunction. Primary hypothyroidism is way more common, and it can be caused by medical removal or destruction of the gland, or by medications containing lithium. This is normally prescribed to depressive patients, or immune destruction of the gland, like in Hashimoto thyroiditis. Given the actions of T4 and T3, hypothyroidism will cause clinical manifestations in relation with a slow metabolism. This time we use an image to display the characteristics of this hypothyroidism state. And as you see, some of the main symptoms of hypothyroidism, which can take years before they are even recognized, include weight gain despite a loss of appetite because of the lower basal metabolic rate, cold sensitivity because the body is producing less heat, and slower heart rate, mental slowness, lethargy, and constipation because of the decreased effect of thyroid hormones on the sympathetic nervous system. Accumulation of glycosaminoglycans also cause myxedema, or swelling in the skin and the soft tissues like the tongue. If the hypothyroidism is caused by Hashimoto thyroiditis, there can be a goiter, which is an enlargement of the thyroid gland because of the hypertrophy and hyperplasia of the gland. Babies with congenital hypothyroidism will have symptoms related to the decreased metabolic rate, like excessive sleeping. But if the condition isn't detected quickly enough, they have risk of mental retardation and irreversible intellectual disabilities, also delay physical growth and shorten height because of the role of thyroid hormones in brain and sympathetic nervous system development. All of the normal symptoms of hypothyroidism become exaggerated. For example, mental slowness may turn into altered consciousness and confusion, and decreased body temperature may turn into hypothermia. For diagnosis, however, medical history and physical examination go first, and then the 3 levels of T4, T3, and TSH should be measured. Like in most hypofunctional endocrine conditions, providing the synthetic hormone is the best treatment available now. Alright, so hyperthyroidism is also called thyrotoxicosis, and is generally due to an overproduction from the thyroid gland. Now, hyperthyroidism can happen a few different ways. All of them result in too much thyroid hormone and an hypermetabolic state where cellular reactions are happening faster than normal. The most common primary cause is Graves' disease, which is an autoimmune disorder that we will review in a minute. Another primary cause is toxic nodular goiter, where one or more follicles start generating lots of thyroid hormone. In some cases, it's because of a mutated TSH receptor that inappropriately keeps these follicular cells active. A different cause is a hyperfunctioning thyroid adenoma, where the follicular cells start growing uncontrollably, forming a benign tumor and making excess thyroid hormones. And finally, neonatal hyperthyroidism, which is when newborns who have a mother with Graves' disease start generating too much thyroid hormone in response to thyroid stimulating immunoglobulins that crosses the placenta and enter the baby. A second cause of hyperthyroidism is when there's a healthy thyroid that generates a lot of thyroid hormone in response to a TSH secreting tumor in the anterior pituitary. The symptoms of hyperthyroidism include weight loss despite an increase in appetite because of the higher basal metabolic rate. Also, heat intolerance because the body is producing more heat, and a rapid heart rate, sweating, hyperactivity, anxiety, and insomnia because of the effect of thyroid hormones on the sympathetic nervous system. This sympathetic stimulation of muscles that control eye movements also makes the eyes appear more open than normal, so you see more of the white part of the eyes. If the hyperthyroidism has been ongoing for a long time, there is a risk of developing congestive heart failure and osteoporosis. Graves' disease is an autoimmune disorder, and normally that means that destroys the gland, so you should have less production of those hormones. But it's not the case here, and we will see how that happens. It is more common in women between 20 and 40 years of age. And what happens here is that B cells produce antibodies against several thyroid hormones. It is characterized by hyperthyroidism, goiter, and enlargement of the thyroid gland, and ophthalmopathy. Okay, so what happens with the antibodies? These autoantibodies include thyroid stimulating immunoglobulins, which bind to the TSH receptor on follicular cells, and they imitate the action of TSH. This results in growth of the thyroid gland and stimulates the follicular cells to produce excess thyroid hormone. The disease has a familial tendency, showing an important genetic component. And finally, we have thyroid storm, a life-threatening complication of hyperthyroidism, where the body goes into a state of severe hypermetabolism and can develop when someone with hyperthyroidism stops their treatment with hormones, develops infection, or has surgery. All of the normal symptoms of hyperthyroidism become exaggerated here. For example, heat intolerance turns into a very high fever, and rapid heart rate turns into cardiac arrhythmia. The situation requires rapid diagnosis and treatment to save the patient's life. Right, so diagnosing hyperthyroidism is done by measuring the blood levels of TSH, T3, and T4 again. If it's due to primary cause, TSH will be low and unbound thyroid hormones will be high. Once hyperthyroidism is confirmed, a radioactive iodine uptake test and a thyroid scan help determine the specific cause of the disorder. If blood levels of TSH are normal or high, this points to a pituitary tumor, which can be confirmed with an injection of thyrotropin releasing hormone. Treatment varies based on the exact cause of hyperthyroidism, but generally involves drugs like beta blockers to treat the immediate symptoms and anti-thyroid drugs to block thyroid hormone production and release. Radioiodine therapy can be used to partially or completely destroy the thyroid function, and if you do that, of course, you'll have to follow with replacement hormone therapy. In a few cases, the thyroid can be removed through surgery. And to finalize, here you have a table that compares the clinical manifestations of both hypo and hyperthyroidism. So now let's go for those 4 tiny glands that control calcium blood levels.